We are Team SCGPT. Imagine this. Meet Rachel Adams. She's a young 19-year-old girl and was just diagnosed with kidney disease. She's healthy in all other ways but has several dietary restrictions. She still wants the ability to travel and experience life as a normal 19-year-old girl would. Rachel is not alone in this. Currently, 133 million Americans suffer from one or more chronic disease, which is an estimated 49% of the total population. The amount of people suffering from chronic disease poses one issue, but arguably an even bigger issue is how chronic disease impacts the patient, the environment, the economy, and the general population. One of the biggest issues for those suffering from a chronic disease is the quality of life. Usually they'll experience a decreased mental health. Around 1/3 of those with a chronic disease have reported suffering from depression. It also comes along with physical limitations, a decrease in energy, extreme dietary restrictions, feelings of guilt or shame, and can be extremely time consuming between all the doctor's visits, testings, and pharmacy visits patients must make. Chronic disease accounts for 81% of hospital visits, 91% of all prescriptions filled, and 76% of physician visits. They are also the leading drivers for the $3.5 trillion spent in annual healthcare costs, according to the CDC. Obesity is at the forefront of chronic disease initiation and/or progression, and the most common cause for obesity is poor diet and/or lack of exercise. The CDC estimates that by eliminating 3 risk factors, poor diet, smoking, and lack of physical activity, would prevent 80% of heart disease and type 2 diabetes, as well as 40% of cancer instances. These numbers are super important because it shows how important diet is, especially in the initiation of a chronic disease. So part of our goal is to be So what's the problem? The problem is that there is no device that is able to calculate different amounts of electrolytes and minerals in food or drinks before they are ingested. The goal of SCGPT is to allow patients to be proactive in slowing the likelihood or of developing a chronic disease altogether. This will allow for an increase in quality of life of patients, a decrease on healthcare costs, it will ease the burden on caretakers and health professionals, and decrease the impact on the environment. It will also allow for Rachel to do things she wants, such as travel the world with confidence that she will know what is in every bite of her food. Doctors
So currently on the market, there is only one product that detects ion concentration, the Horiba LaCroix Twin. Either is sold in potassium, nitrate, calcium, or sodium. Shown is the sodium pocket meter. So what is cool about these is they're able to be used on liquids, solids, and powders. Many ion selective electrode meters are not compatible with solids or powders. They're only usable in liquids, so this device is very advanced. They sell for about $300 each, and they are not sold together, which is what we want.
SCGPT's value proposition is that it's a new to market idea. There's no other device out there that can calculate several different components of electrolytes and minerals in food, and it's also going to be convenient. It's small and portable, and it can be brought anywhere. And it's also universal. Although our target market is patients, this device can be used for those who are interested in dieting for gym and competition purposes and other.
So for our solution, we want to create a SciDrip website, which is also compatible through like your phone, and if things work out, we will be able to make an application that you are able to download on your phone, and people will be able to record or upload the amount of the concentration read off the device, and they're able to keep track for themselves or for their medical professionals. And also, our solution is to use the technology of ion selective electrodes to create or to make the device better. And so for our resources, our website will cost around $20 to $50 because of the domain or host that we will be hosting the website on. And we would like $1,000 for the creation of the device, and also maybe and also to analyze our competitors such as the Horiba Lacroix twin.
Team SciDrip thanks you for your time.
So for our appendix, we're supposed to answer common questions you guys might have, and for one definite question, maybe how do ion selective electrodes work? And so ion selective electrodes are a sensor that is used to detect the concentration of a specific ion. It converts that ion activity into an electrical potential that is read from a voltmeter. And mostly ion selective electrodes are very important in water quality, and so that will kind of give you an insight onto how like important ion selective electrodes are and how they are used to like detect different elements within. And so more on like the components of an ion selective electrode meter is that it consists of two electrodes, and there is one sensing electrode and also one referencing electrode, which will lead to the point where, although this pocket meter seems very convenient, you may need to carry like a zeroing out solution or a reference solution just to make sure that the meter is balanced. And within that sensing electrode, there is a membrane that only allows that specific ion to pass through. I discussed it back in the past slides about how we would like to have separate membranes that you are able to put into that device in order to get different pocket meter readings. So once you get that, once that reading is recorded, it will be converted. So based on the Nernst equation, the concentration gradient is proportional to that electrical gradient. So before you even get that reading, there will be like a conversion from electrical to the actual concentration. And that should hopefully answer your question about ion selective electrodes. As of right now, we are not sure of a prototype or like a sketch of a prototype or what type of like the sizing or the components, but I think it's very important that the technology and the principle of what we want to do is very established, and I hope that that answers your questions.